right, I think we can start getting ready here. Good morning, everyone, and welcome. Welcome. We're delighted that you could join us today. We have about maybe 12 or a dozen or more people in the room with us today, and we have, I guess it's about 15 or so, 20 people participating by Zoom. Thank you all for joining us. Before we begin, let me first tell you my name. I'm Dr. Robin Gershon. I'm the PI, the principal investigator of an ADA funded study from the Pacific ADA Center. Today, we're delighted to involve so many wonderful colleagues and friends of ours over the past couple of years that we've been engaged with. And we're especially delighted to have our ADA Center Director from Pacific ADA, and that is our wonderful colleague, who's also a lawyer, Jerry Davidson, and she'll be talking in just a little bit when she comes up with the work that she and Jan have been doing. First, though, I'd like to also thank our coordinator, Owen Slyman, who's our student project coordinator. He's done a great job pulling this together. I'll be talking to you a little bit later about some of our results. We also have Tamsin, who's our wonderful other project coordinator. Thank you so much for helping us. We have Molly, we have Selena, we have Kay, who's helping monitor today. So thank you all. But first, before we get started with our program, we have a special note of welcome from our wonderful coordinator of the NYU Center for Anti-Racism, Social Justice, and Public Health. This is a center that's run by Dr. Melody Goodman, and we're going to have Daniel Joyner welcome us today as a project coordinator for that center. Thank you so much.
Thank you. I appreciate the clapping from the room. I appreciate it. So as Dr. Gershon said, my name is Danielle Joyner, and I'm the project coordinator here at the Center for Anti-Racism, Social Justice, and Public Health, working directly under Dr. Melody Goodman, who unfortunately could not attend today, but she will be joining virtually if she has not already. But I really just wanted to say thank you. We're really happy to collaborate on this event. It's going to be amazing. Our center really heavily focuses on public health research related to social justice, specifically around policy change. So we are doing a lot of work. We have a plethora of events and research and programs that run out of our center. So if anyone's really interested in getting involved or joining our mailing list and seeing a lot of the things that we do, please let me know. But otherwise, I won't keep anyone, and I hope everyone enjoys our event today.
Okay, so as our first order of business, we have a presentation by both Jerry and her colleague, Jan Garrett. Now, some of our students are familiar with Jan because she is a beloved lecturer and guest discussant in 3 of our disaster courses. So they know her quite well. In fact, it goes back several years. I had the privilege of meeting Jan about 2 or 3 years ago, pre-COVID. I guess it's 4 years ago. And it was delightful to meet her in person. I'm so sorry she can't be with us today, but she is going to be on Zoom. But first we have our wonderful partner in crime, Jerry, come up. And she and Jan are going to be talking about the history of disability in the ADA. Thank you.
So great to be here, and it's been quite the privilege to partner with New York University on our research. We are a grantee of the National Institute on Disability, Independent Living, and Research, Rehabilitation Research. And so part of our funding from them is to expand the field of disability research, and that's something that we've been able to do through a partnership with NYU and the University of Guam. When Robin started talking about doing a DEI presentation about disability, I got really excited because I don't think that disability history is something that we're taught in schools, and I don't think we get a sense of the struggles that the disability community has faced in the past and are still facing today, and how it intersects with other disability rights movements.
People on the Zoom are asking if you could speak up, sorry.
Okay, yes, absolutely. Former cheerleader here. So, and so I think that it's just really key to understand how it fits in this DEI realm of study to know the history and the struggle of this group of people. I just want to quickly point out, and when Jan comes in, I'm going to have her introduce herself and talk a little bit too about her disability, but I am a person with a disability. I have a non-apparent or hidden or invisible disability. It goes by many names, but I have depression and anxiety. When I was in law school was kind of when it manifested, and I tried out a bunch of different medications, and one of them gave me some really bad side effects, so I stopped taking it, which then led to a manic episode. Which then led to me overdosing on that medication, and I was almost committed to a psychiatric hospital, but through family advocates, I was not. And I think that's important to understand where my passion comes from, because I almost lost my rights to make decisions about myself when I was 25. And so I wanted to share that perspective with you, because it's still happening today. You know, it's still happening to people with disabilities, that discrimination. Okay, I'm gonna get this started, and then when Jane comes in, I'm gonna let her talk a little bit about herself. Are the slides gonna come up? Okay, perfect. Okay, so we're gonna talk about disability history and the Americans with Disabilities Act. I think it's important to point out that the Americans with Disabilities Act is a very comprehensive law. It covers a lot of different areas, but it is not the only disability rights law. And so we're going to throw in some others. I'm going to take you through a lot of different areas here, and I don't have the time to go into the data and the statistics and the research, but if anyone is interested, our contact information is going to be on that last slide. And so if you're interested in learning more about any of these things, feel free to reach out and I'll give you more information. Okay, next slide. So we're going to talk about a history of segregation and discrimination. I want to give a content warning here, because we're going to talk about some tough stuff. Anytime you talk about a civil rights movement, you're going to hear some things that are very unpleasant. We're going to talk about institutionalization, sterilization, just discrimination in general, and stigma. So just wanted to kind of give everybody a heads up. The photo on the slide here, just to be accessible for people with visual disabilities, is a photo from a disability rights protest, and you can see people with different types of disabilities. They are holding some posters that say, "We shall overcome, access is a civil right," and this is in the 70s. Next slide. So I know you all are brilliant students, and so this isn't any news to you, but disability doesn't exist in a vacuum. These problems that we're going to talk about today are also exacerbated by other intersections with other populations, because disability doesn't discriminate. It intersects with all ages, races, religions, genders, sexual orientations. And as you know, multi-marginalized individuals tend to experience these barriers that I'm going to talk about at higher levels. And then obviously poverty is always an exacerbating factor. So when I'm talking about these things, I'm certainly not talking about disability alone. We know that these things are greater in populations that are already marginalized. Next slide, please. So I want to start by talking about education. Historically, people with disabilities were not educated in the same schools, in the same classrooms, or at all with students without disabilities. You can see a picture here of kids with disabilities. They are two to a bed here. These are like wooden, bed is a loose term I'm using. They're kind of like little wagon crates with wheels on the side. They're just laying there. They're not being stimulated in any way whatsoever. This kind of institutionalization was common pre-1970s. It's if you had a child with a disability, you were told as a parent that the best thing for them was to put them in an institution. Only 1 in 5 students with disabilities were taught in school around that time. This kind of broke wide open when Geraldo Rivera did an expose on a school called Willowbrook. And he went in there and it was just people sitting in dark rooms, just piled together, being neglected, no supervision in sight, no stimulation. And that's when people started really looking into institutionalization of kids with disabilities and adults with disabilities. Next slide, please. So we had some legislation that came along that really helped with that. It was called the Education for All Handicapped Children Act. It later became reauthorized and renamed, thank goodness, as the Individuals with Disabilities Education Act. And that is what you see in effect in most public schools today. And that gave schools the directive that they have to actively seek out and find the students with disabilities and evaluate them for services. And so, and create individualized education plans for them. So students had to be placed in the least restrictive environment according to the law. And then they have to be offered outside services and supports if they meet those criteria for those. So we're talking about speech and occupational and physical therapy. We're talking about behavioral services, counseling. All of those things are supposed to be able to be accessed in that public school setting. There's also other education legislation, but this is the kind of key one. So for time's sake, we're just going to focus on that. Next slide, please. Despite this legislation, because we know a civil rights law doesn't solve the civil rights issues. It can make progress, but there's still some lingering issues today. And the ADA also covers some education stuff, but it's not nearly as specific as IDEA. But we still see segregated classrooms. They are doing a much better job of doing some integration into regular education classrooms, but it's still very much a problem. There's a lack of funding for sufficient supports and services. So even if you qualify for those supports and services, you may not be able to get them. We see more suspensions and expulsions for students with disabilities, especially students with disabilities of color. Discipline is also more harsh. And then there's also these things called certificate tracks where students with disabilities are filtered into tracks that are non-diploma and then have much harder time finding jobs once they're out of school. And then a lot of students with disabilities only get a certificate of attendance. And that just means you came to school for 22 years. They're allowed to go to the age of 21 to the end of 21. So they come out with a certificate that says you came, and they can't really do anything with that. Next slide, please. Employment historically. So back a long time ago, I'm guessing around 1930-ish, there were these ideas called sheltered workshops. And that was a place where people with disabilities who couldn't find jobs in the regular economy could go and work and typically do contract work and make a little bit of money. These were touted as a good thing, and I think there were good intentions to give people some job skills. And so these were a way to get people out of their homes to make sure they were doing something productive and contributing to society and earning a little bit of money. We'll see how that plays out in the next slide, but there's also, when the Fair Labor Standards Act came along, it did a lot of great things, but one thing it did for people with disabilities is it allowed people with disabilities to be paid below sub-minimum wage, and that still exists today. And it was meant to, again, to give people jobs who maybe couldn't hack it in the regular economy, but it also just set the standard that people with disabilities couldn't work, they couldn't do regular jobs, they needed to be paid less than their peers without disabilities. Again, still on the books, federal law today. And then obviously just the stigma and discrimination has always been a part of employment for people with disabilities. Is my volume okay? Am I getting low again? Okay.
Yeah.
All right, next slide, please. So employment legislation came along. So we have the Americans with Disabilities Act, Title I, does a great job of prohibiting discrimination, outlines processes for reasonable accommodations. It's a really solid law when it's enforced and done correctly to protect people with disabilities in employment. There have also been some state sub-minimum wage laws because what happened with those sheltered workshops is people got stuck there. They were supposed to be a temporary place where people go to train, learn skills, and then go out into the community. What we have found is people stay there for 30 years and they are getting paid pennies on the dollar. Like some paychecks for a 40-hour week will be like $10. And it's still happening today. And this is currently still legal in New York. There's a law on the books that's pending, so we're hoping, to see that eliminated. But that is what happened. It became instead segregated employment, not a way to work people into the regular economy. And so that's kind of where we are with legislation right now. Next slide, please. So with those lingering issues, there's still the stigma and discriminatory attitudes. We have people with disabilities who contact us sometimes and they're like, what kind of jobs can I do? And we're like, any kind of job. There are not jobs that are specific for people with disabilities. So, what are your talents? What are your skills? What are your qualifications? And so it's not just people discriminating against people with disabilities, it's that they've been discriminated against their whole life or told they only fit in a certain subset. So it's really just kind of educating about that. There's some myths out there that people with disabilities are a liability, that costs will go up. There's also just a fear of saying or doing the wrong thing and that you're going to put yourself at risk for legislation. For a lawsuit. So there's just a lot of reasons why people with disabilities are still not in the labor force at the same rate as people without disabilities. There's a lack of understanding about the ADA. There's a lot of employers who don't understand what their obligations are. There are a lot of people with disabilities who don't understand what their rights are. And so it's really about educating and really making sure people understand their rights under the Americans with Disabilities Act. As I mentioned, that sub-minimum wage still exists in a lot of states. More and more states are outlawing it. I think if I had to make a guess, I think we're probably about 13 states maybe. 13 to 15 states have outlawed sub-minimum wage at this point. And then there's still a huge employment gap. Okay, next slide, please. And I'm going to pass this over to Jan now, and she's going to take over our next two categories.
Great. Thank you, Jerry. And hello to everyone in New York. This is Jan Garrett. I'm the Deputy Director of ADA Programs for the Pacific ADA Center. And I miss seeing you all in person, but I appreciate you all having this seminar and inviting us to speak about the ADA and historic discrimination against people with disabilities. So Jerry did a great job of giving you an introduction to that. And so I'm going to talk about a few other categories of discrimination and kind of a little bit about where we are. So housing is a huge issue. It was historically, and it still is. As Jerry mentioned earlier, people with disabilities were institutionalized and still are to some extent. People are living in mental institutions. People are living in nursing homes, which are considered institutions as well. And so people with physical, intellectual, psychiatric disability are still living outside of the community, despite the fact that Olmstead, the U.S. Supreme Court case that said that everyone should be integrated into the community as much as possible, that case is now 24 years old. So really, people should be integrated into the community, and states should be giving a preference for that. But there now is a lack of affordable and accessible housing options, despite even a lot of new housing that is built. Next slide. So there is a Fair Housing Act that was initially passed in 1968. And in 1988, it was amended to include people with disabilities. So that basically says you cannot discriminate against people with disabilities in housing, and housing that is built after 1991 needs to have accessibility. But, we all know that there's a lot of housing that is still out there that was built before 1991. And even housing that is now altered or renovated does not have to add accessibility when they do that. So the Fair Housing Act is not nearly as good of a law for people with disabilities as the ADA and some other laws are. Also, the Rehabilitation Act of 1973, specifically Section 504, says that when you give federal money to housing projects, that it is subject to 504. And when you build housing projects using federal money, there are very specific accessibility requirements that are there. So that's at least a very helpful law for housing, again, new housing. And then the ADA does not really apply to private housing, but it does apply to housing that's built with state or local government funds, and where like housing authorities build and manage those facilities. The ADA does apply to that. And it also applies to things like the leasing office and areas that are open to the public. And so those areas do need to comply with the ADA accessibility requirements and non-discrimination requirements. Next slide. So there still are a lot of lingering issues. Affordability of housing. Many people with disabilities cannot afford to actually rent apartments out there, particularly in large areas like the Bay Area where I am, and New York where you guys are. Affordability of housing is a very big issue. Again, accessibility. New housing is supposed to be built in an accessible way, but there's a lot of housing stock out there that is still not accessible. And then we still have institutionalization. We still have people being placed in institutions and nursing homes across the country when they could really live in the community. Next slide. So healthcare. Healthcare is also another enormous issue for people with disabilities. People in the healthcare industry still look at people with disabilities as patients. Of course they are, but that they need to be cured. And that if you can't cure you of something, that, you know, why treat you with any respect or dignity? So there's also a lot of congregate medical care. Babies are taken away at birth when they have a disability. That was not really true so much anymore, but it certainly was true when I grew up. And my own mother, when I was born, and I'll describe what I am a woman who is in her early 60s. I have no limbs, no arms and legs. And so I was born without my limbs. And when I was born, my mother was placed in a room with a woman whose baby had been stillborn, because they wanted my mother to get used to the idea that she was going to place me in an institution. She had really great family support, and she said, no, we are going to take her home and love her. And so I was so fortunate to have the family that I have. But many, many babies were taken away from their mothers at birth and placed in institutions when they were born with a disability. And also into psychiatric institutions when those babies had and young adults had psychiatric disabilities. Next slide. So there is actually healthcare legislation. Again, like I talked about, the Rehabilitation Act of Section 504, when there is federal funding that's involved. And that means any public or private entity that gets federal funding, and almost everyone in healthcare gets federal money, because you have Medicare and you have other, you know, dollars that are coming in. And so Rehabilitation Act Section 504 would apply to all those public and private hospitals, public and private physicians, public and private dentists, all those folks. Almost all of them get federal money. Then you also have the Rehabilitation Act Section 510, which actually talks about accessible medical diagnostic equipment. This has been a huge problem for a lot of people with disabilities over the years, and not being able to be weighed, not being able to be examined, not having a exam table they can transfer to, or x-ray tables. So this actually deals with accessible medical diagnostic equipment. However, it has not yet been adopted as a standard by the U.S. Justice Department. And so it's out there as technical requirements, but not really adopted as standards. And then we also have the Affordable Care Act, Section 1557, is the civil rights section of the Affordable Care Act that does say that people with disabilities cannot be discriminated against in healthcare. Next slide. So there's still lingering issues in healthcare. It's still very much viewed as a medical model. There's a lack of training on community supports and services. There's a lack of training on how to treat individuals with disabilities. And then accessibility, people with disabilities often don't get medical exams like like pelvic exams, like breast exams, because those medical equipment is not accessible to them. And even dental exams, people don't get because the dentists say you cannot come in to have a dental exam without getting a release from your doctor, which is against what the ADA says. There is still institutionalization, as we have talked about. And as we all know, in nursing homes, COVID ran rampant and still is a big problem. So congregate housing, congregate placement in nursing homes is still a huge problem. And there are still genetic testing concerns, even though there is a law called the Genetic Information Non-Discrimination Act, or GINA. And so that's also a big problem of genetic testing concerns. Next slide. So family and, oh, I'm sorry. Did someone say something?
Well, Jan, I was gonna say, do you want me to jump back in here, or were you gonna do
Yeah.
this slide?
Yeah, this is good. Jump back in.
Okay. So just talking about family and community historically, and just the access for people with disabilities, this is where the eugenics movement came in. So basically there was a big movement through the mid 1970s, actually, where people with disabilities were routinely sterilized, particularly those in institutions, but not just those in institutions, to clean up the gene pool, which is shocking that this happened. And actually, Hitler modeled his eugenics movement after the U.S. and what we were doing with the disability community here. And there's some quotes from Hitler that talk about his admiration for what America was doing. And one example, the primary example that's held out, was a 1920s Supreme Court case, Buck v. Bell. And this was a quote from that case. It is better for all the world if instead of waiting to execute degenerate offspring for crime, or to let them starve for their imbecility, society can prevent those who are manifestly unfit from continuing their kind. 3 generations of imbeciles are enough. And that case has actually never been overturned. Obviously, we have come a long way, and folks have realized the atrocities and horrors that were, but that continued through the 1970s and the 1980s. Women of color were particularly targeted, and people were signing documents that they didn't know how to read, that were authorizing hospitals to do these things, or institutions, a lot of psychiatric institutions. Those laws are mostly off the books now, thank goodness. Some may still exist, but it's not routinely happening today. Although there is a lot of stories about incarcerated individuals and sterilization that's still going on today. Next slide, please. Some other historical aspects of family and community discrimination for people with disabilities. There were marriage laws on the books that said people with disabilities can't get married. As far as community access, there were these things that were nicknamed ugly laws, where anyone who wasn't deemed appropriate looking could be denied access to public places. There was a lack of physical access, obviously pre-ADA. There were, not requirements for ramps and elevators and widened doorways, and so getting into places was impossible to go out to the community. And then there were just discriminatory program requirements that would exclude people with disabilities as well. Next slide. So then we've got some legislation. Obviously, the big one here is the Americans with Disabilities Act, which included responsibilities for state and local governments, private businesses, telecommunication providers, so your phone companies, prohibits discriminatory behavior or policies in many, many settings, and establishes the accessibility standards for places of public accommodation that you go into, so restaurants, movie theaters, hospitals, places like that. There's also state laws protecting people with disabilities that go above and beyond the Americans with Disabilities Act, so it's always important to know those laws in your state. Next slide, please. So the lingering issues that still exist for people with disabilities who are trying to have a family or trying to go out into the community and participate. Obviously, that stigma, discriminatory attitudes is a big one. You know, people with disabilities are still viewed from that charity model. People feel sorry for them. People don't make assumptions about what they can and can't do. There's also that lack of understanding about the ADA. So I talked about all the things the ADA does as far as physical accessibility. If you walk around New York, you will see a lot of places that are really hard to get into. And so there's just still a lack of understanding about what those accessibility requirements are. A lack of training on how to accommodate or modify procedures. So it may be that people understand the ADA, but they don't know how exactly to make it work for their organization because it's not a straight black and white issue. You have to look at your policies and figure out what may need to be changed to make sure you're not excluding anyone. There's something called the marriage penalty, which is that when people who are on SSI, which is a government benefit for people who have low income and have disabilities, if two people that are on SSI get married, their combined income drops way low. And so there's a disincentive for people with disabilities to get married. There's still a lot of outdated state laws on parenting and adoption. This is technically not allowed under the ADA, but these are out there. In South Carolina, we helped change one of these discriminatory laws. There's also a lot of outdated definitions of vulnerable adults that make sure people with disabilities are included in this broader definition when there are a lot of people with disabilities who are not vulnerable at all. You know, Jan and I are two examples of that. We are, you know, out here fighting the good fight, and but under some of those definitions in state laws, we would be considered vulnerable adults. There's also rampant guardianship and conservatorship through the court system. Britney Spears is the big example that brought this to everyone's attention, but people with disabilities are having their rights taken away by the court instead of trying things like talking to the person and understanding if they recognize the consequences of what they're doing, instead of treatment and therapy and counseling, instead of medications, instead of assuming that people with disabilities can understand their rights. We have courts who are taking those away wholesale. Next slide, please. So, and we're wrapping up here, but we're here to kind of talk about the Americans with Disabilities Act, which had its 33rd anniversary. If you think about it, it was just passed in 1990. So the major civil rights legislation for people with disabilities is not that old, 1990. And as I mentioned earlier, it has the broadest scope and implications, but there's still so much work to do to achieve equity. I'm not going to get into that because I think your panel is going to talk a lot more about that. But I did want to leave you with the story of Ed Roberts because I'd never get tired of telling his story. So Ed Roberts contracted polio at the age of 14. It left him paralyzed from the neck down with only like limited use of a few fingers and toes. So he spent much of his childhood in an iron lung, which if you haven't seen, is kind of like it's like a tanning bed, I guess. That's why I know to describe it. You can't really move around in it. At one point, Ed Roberts decided that he didn't want to live anymore. He didn't have anything to live for. And so he basically went on a starvation diet. And he jokes about this, but he's like, if you don't have the use of your arms and your legs, how do you kill yourself? And so starvation was the way that he decided to do that. And as he started to lose a lot of weight, he realized, wait, if I have this much control and this much determination, imagine what I could do if I decided I do want to live a life. And so that kind of turned his whole perspective around. He fought to go to public school. He was one of the first students with a significant disability to attend the University of Berkeley, UC Berkeley, and then he went to the Department of Vocational Rehabilitation to find employment. And they told him his disability was far too significant. So he said, I'll be back. And he went and got his master's degree, and then later came back to be the director of the California State Department of Vocational Rehabilitation. He also created one of the first centers for independent living in California, which is a peer-to-peer disability run network. And Jan is one of the former directors of the CIL that he helped create. And also I came from that background too before I came to the ADA Center. So it's just really cool. And it just shows that for someone who had all of the stigma against him, he was able to fight back against that discrimination and force his way through and pave the way for so many of us. And so I always like telling that story. Next slide, please. So this is just our information. So just so you know, the Pacific ADA Center serves the Pacific region, and that is our contact information. You're going to hear from Wendy and some of her staff later. They actually serve the New York State and some of that region. But you can always call us and ask questions, call your region. That we're a part of a larger network called the ADA National Network. And so if you're not sure what region you're in, you can always look them up, and they'll tell you what region you should contact. But we're here to answer any questions about people with disabilities and their rights and the Americans with Disabilities Act. And we just want to be a resource for you all. Thank you so much.
We have time, do we have time for a couple of questions? Keeping track?
I think I used it.
Yeah, we did all the time, but we can come back to questions at the end.
Okay, thank you so much. Thank both of you so much. That was a daunting recap of where we are, and really the troubling and horrific history that we have to confront. I'm glad that you ended it with Ed Roberts and his story, and you know, the will that can drive so much change, but obviously we have a long way to go. Why don't we jump right into our next speaker? We're delighted to have Mr. Ed Erickson. William. Bill. Bill is our Senior Research Specialist at the Yang 10 Institute of Employment and Disability at Cornell. And he's going to be providing an overview of the statistics on disabilities. Thank you so much, Bill.
Thank you. Next slide, please. Thank you for joining me. Next slide. Okay, yeah, so I'm Bill Erickson. I'm a research specialist. I've been doing disability research for nearly 25 years now at Cornell University's Yang 10 Institute on Employment and Disability. Next slide. Okay, so okay, some people say, oh, geez, numbers, disability statistics, who cares? This is just numbers. I don't want to deal with them. And so why would you care? And basically, disability statistics, the numbers can really help. Can help policymakers and service providers, advocates to say, sort of give you a sense of, okay, how many people are we talking about here? What are the issues we're talking about? And the numbers can help convince people to, change legislation or, develop special, programs to serve people with disabilities better and try to figure out what are the issues behind them. And they can help, support effective planning and help improve, what an understanding of the barriers and what might be better supports. And so one of the things I'm in charge of for the past, I know it's been over 15 years now. We have a website, disabilitystatistics.org, which are designed specifically to provide usable and helpful disability statistics. So I'll be talking about in this presentation about a lot of the disability statistics are available. Actually, all of them are available on our website. So if you wanted to delve deeper, you can do so. Okay, next slide. All right, so I'll be talking about a little bit about data sources. Where does the information come from? Defining disability, which is a very sticky wicket, shall we say. I'll try to briefly talk about that a little bit, talk about disability prevalence rates, so I'll give you a sense of, okay, what is the population we're dealing with, at least according to this one major survey. Talk a bit about the intersectionality with other characteristics that have been mentioned by the previous speakers. And also to talk about some of the disparities that people with disabilities experience with regards to employment, poverty, COVID issues, long COVID, from another Census Bureau survey I'll be briefly talking about. Okay, next slide. Okay, so what we've developed and what's available on our website is we've developed these what are called disability status reports. And the data we're working with is the US Census Bureau's American Community Survey. The data I'm specifically working is I'm actually analyzing their public use microdata sample. So I'm actually generating my own estimates based on this sample. The ACS includes the household population as well as people living in non-institutionalized group quarters such as dormitories and group homes. The ACS actually does include a sample of people people living in institutions as well, but we tend to focus on the household population and non-institutionalized group quarters because we're looking at issues such as poverty and income and employment, where there are only measurements for that group, not for the institutionalized population. The overall sample is 3.5 million US households every year, so it's a massive sample. It's larger than any other survey done in the US, with the exception of the decennial census. That actually has replaced the decennial census in terms of collecting a lot of detailed data, which is one of the really useful things about working with the ACS and one of the reasons why we use it. Okay, next slide. So again, if you're interested in exploring some of these numbers in more detail, if you're interested in looking at perhaps your own state like New York, what we do is every year we develop these reports that provide information on prevalence rates within that state, employment rates, poverty rates, a wide variety of information. They're all freely and downloadable on Disability Statistics. Again, so feel free to explore that. Okay, next slide. Okay, so onto the data. So you'll actually be according to the American Community Survey and their definition of disability, which I'll be talking about in the next slide, there are about 13% or about 42.7 million individuals with disabilities, the non-institutionalized individuals with disabilities. So it's a very large population. And again, beware, this is based on the ACS definition. This does not, the ACS, well, actually, when you go to the next slide, we'll talk about it a little bit further. We've been talking about the ADA and how the ADA is a much broader definition of disability, but unfortunately, it's very, very difficult, practically impossible to really define and collect through survey means in terms of trying to figure that, define it. So next slide, please. So basically, for the American Community Survey, talk about these are the 6 types of disabilities that they ask about. This is much better than prior to about the year 2000, where they only asked maybe 1 or no questions about disability prior to that. So this is 6 questions is a huge improvement. And the overall disability category includes people who are reporting 1 or more of these 6 disability types: a visual disability, which is asked of people of all ages; hearing disability; ambulatory disability, difficulty or serious difficulty walking or climbing stairs; a cognitive disability, which is the question is because of a physical, mental, or emotional condition, have serious difficulty concentrating, remembering, or making decisions; self-care disability, people have difficulty dressing or bathing; and independent living disability. Because of a physical, mental, or emotional condition, does this person have difficulty doing errands alone, such as visiting a doctor's office or shopping? So just looking at this, this set of questions, again, it's a huge improvement over what was or wasn't asked about disability in the past. But you may notice that basically if you have an upper body limitation, it's not really, may not be captured by these, any of these 6 categories. So you may likely fall into a person without a disability, according to its definition. It also doesn't collect any, or attempt to get anything at regarding mental illness, which is a very large proportion of people with disabilities or people with psychiatric difficulties. It also doesn't ask about anything about chronic health conditions, which is another category that the ADA covers, but is not captured here. So it's limited. It's the data. This is the data we work with because this is, again, it includes a lot of other information that allows you to look at, again, limited disability categories, but allows you to look at a lot of other issues such as employment and poverty and occupation and all these sorts of other types of information. But there are limitations, so just be aware this is not perfect, but this is what we're working with. And actually, I just want to also mention that I think one of the other presenters following me will be talking about a much higher proportion of people with disabilities, around 26% according to a CDC survey. Interesting enough, it actually uses the almost identical questions to these in the ACS. But generally, it's been shown in a number, actually some Canadian studies as well, that when you use the CDC, obviously it's a health survey asking people about lots of health questions and also asking about disability, and that may sort of prime people to be thinking about their health and more likely to respond, yes, I have this as disability, because they're already thinking about health issues. So that may be one of the reasons why that proportion is higher in this behavioral risk factors surveillance system survey that the CDC runs. But that is also based on a much smaller sample size. You can't do as much with it. It doesn't collect good information about employment or poverty and a bunch of other areas that are non-health related. So it's pretty limited. So that's one of the reasons why we like to work with the ACS. Okay, next slide, please. All right, so there's a wide, so as I mentioned, there are the 6 kinds of disabilities, as you can see here. It varies. This is for all ages, a non-institutionalized population in 2021. And 13% is the overall, but there varies quite a bit by the type of disability. About 2.5% report a visual disability, 3.6% hearing disability. The highest, most common disability type is ambulatory, 6.6%. Cognitive is 5.4% of the population, 2.5% report as healthcare disability, and 5.7% independent living. So one of the things also important to note is that obviously if you add all these types up, it's going to add up to a lot more than 13%. That is because many people report more than one type of disability. And so and about half of the working age population actually report of people ages 21 to 64, about half of the working age population who reported disability report more than one disability. So just to be aware of that. Okay, next slide, please. Another thing that has a huge impact on the proportion of people with disabilities is age. Younger people, say people ages 5 to 15, about 5.8% reported disability type. 16 to 20, it jumps up to 7.6%. About 11% of the working age population, 21 to 64, reported disability. About a quarter of people ages 65 to 74 reported disability, and nearly half, 46.1% of people 75 years older and older reported disability. So this is another thing that you need to be aware of. If you ever confronted, you look at a news article and say, oh, X% of people have a disability. Okay, who are you talking about? They rarely, often don't include ages, or if including the institutionalized population. It makes a huge difference. So just to be, whenever you read information about disability or articles about it, you need to look at, okay, who exactly are they talking about? Are they talking about the appropriate even age group, and which they may not, and they may not even state it, but it's something to always keep in the back of your head is, okay, who are they really talking about here? Okay, next slide, please. Okay, so now from this point onward, for the most part, I'll be talking about the working age population. As mentioned, about 11% of people of working age have one or more of the 6 disability types, as noted in the American Community Survey. Okay, next slide, please. I guess another thing, so this is a map of the U.S. And this map shows the prevalence rate by state, and you can see it varies quite a bit overall by state. And this is of the working age population, ages 21 to 64, again based on the ACS 2021, and it ranges anywhere. The low is in New Jersey of 8%, up to a high of nearly 18% in Mississippi. And you can sort of see what's sometimes referred to as the Rust Belt. Mississippi, West Virginia, Kentucky, Arkansas have some of the highest prevalence rates. They're perhaps not coincidentally, they also are areas with some of the highest poverty rates in the US. And so healthcare and, potentially, availability of or likelihood of food deserts and things like that, not uncommon in those areas. So that they're very likely that may be one of the explanations of why the prevalence rates are so much higher within certain areas. Okay, next slide, please. There's also quite a bit of a difference in prevalence rates by race. Native American or Alaskan Native people who are of that race, 15%, 15.2%. Report one or more of the 6 disability types, followed by Black African Americans, about almost 14%, 13.8%. Black African Americans, about 11%. Individuals who define themselves as white, 10.3% who identify themselves as some other race or multiple races, and 5% of Asians. This may be, and this is really common, sort of an interesting thing, is when you look at demographics of people with disabilities, Asians always have the lowest prevalence rate. It may be that perhaps that group is less likely to have a disability. There also could be cultural differences in how people respond to surveys. Most of the data, nearly all the data on disability is actually based on self-report surveys. And so depending on whether people feel comfortable identifying themselves as, yes, I have this disability, or if it's, this is something you don't share with anyone, including the Census Bureau, may be less likely to respond yes to these questions. So that may be one of the reasons, perhaps, why there are differences in prevalence rates by race. All right, next slide, please. Okay, so as was mentioned by the previous speaker, there's huge differences in employment rates for people with disabilities. Although, so currently, based on as of 2021, about 41.1% of people with disabilities ages 21 to 64 are employed, compared to 78.6% of people without disabilities. So that's a gap of 37.5%. So they're doing a little bit better than half, but not a whole lot better. On the positive side, this is much better than I've ever seen the employment rate for people with disabilities over the past 15 years or so that have been looking at this data. The pandemic actually seemed to be, or recovering from the pandemic seems to have actually helped get people with disabilities into the market, perhaps because of the increased willingness of employers to, when they're desperate to find employees, maybe they'll be increase their likelihood to hire people with disabilities. And also remote working is becoming far more common, as we all know, and that also may increase the opportunities for people with disabilities. So it's not great, but it has been improving steadily over the past couple years now. So somewhat encouraging. Next slide, please. Employment rates vary quite a bit by disability type. People with a hearing disability, 40% of people with a hearing disability, 40% of people with a visual disability, 40% of people with a mental disability, 40% of people with a cognitive disability, 40% of people with a mental disability, 40% of people with a cognitive disability, 40% of people with a mental disability, 40% of people with a cognitive disability, 40% of people with a mental disability, 40% of people with a cognitive disability, 40% of people with a mental disability, 40% of people with a mental disability, 40% of people with a cognitive disability, 40% of people with a mental disability, 40% of people with a cognitive disability, 40% of people with a mental disability, 40% of people with a cognitive disability, 40% of people with a mental 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 disability, are about 55.7% of those with a hearing disability are employed, followed by about 48.2% of people with a visual disability. Cognitive disability, about 33.8% of people with a cognitive disability are employed, about a quarter of people with ambulatory disabilities, 20% of people with independent living disabilities, and about 16% of people with self-care disabilities are employed. But again, as you can see, there's a huge variation here. Okay, next slide. There's variation in employment rate by race and disability. So one of the things we always try to do is provide sort of a comparison level to sort of see. So always try to set, people with disabilities versus people without disabilities. There are differences, unfortunately, by race in terms of employment rates. So this gives you a sense of, okay, what are the discrepancies, limiting it to certain types of certain categories of race, and to see, okay, what are the differences there. So maybe a little bit harder to see, but Black or African Americans have the largest gap, about 41%. 75.1% of Black African Americans are without disabilities are employed versus 34.3% of those with disabilities. So a much bigger gap there than, say, the white individuals, where the employment rate is 80.3% of those without disabilities versus 42%. So a gap of about 38%. So you can see, there's variations here by employment rates by disability. Okay, next slide. There's also, as you might expect, given poverty rates are determined by household income, that people with disabilities are far more likely to be living in poverty than those without disabilities. Nearly a quarter, or basically a quarter, of people with disabilities of working age, 21 to 64, are living in poverty, compared to about 1 in 10 of those without disabilities. So they're actually 2.5 times more likely to be living in poverty than people without disabilities. So it's a huge gap there. Okay, next slide. So one of the things I wanted to talk about briefly is I mentioned COVID earlier on, and as we mentioned in the previous presentation as well, the population with disabilities has been hit much harder by COVID than individuals without disabilities. This first category, it's a little bit harder to unravel because we don't have a good measure or equivalent measure pre-COVID of symptoms of anxiety or depressive disorder. But for people with disabilities, almost 60% of people with disabilities reported having symptoms of anxiety or depressive disorder versus about a quarter of the general population. Now, I think this is actually sort of an interesting fact too, is that this is based on the Census Bureau Household Pulse Survey, which was a survey that was implemented, began just a few months after COVID struck, where the Census Bureau and other agencies from the federal government wanted to know, okay, what is the impact of COVID? How is it affecting people? What's going on? What can we do to help improve the situation? So it's a survey that's been going on since, again, I think it's about June of 2019, and is continuing going on. So you look at the symptoms of anxiety or depressive disorder, it's like, okay, people without disabilities, a quarter of them are reporting a disability, basically. So obviously the basic questions that they were using in the Pulse survey, which again were slightly different than the ACS, were not captured as people with a disability. So obviously there's a lot larger proportion of the population who's not being identified by some of these questions. So just something to be aware of. In terms of ever experiencing long COVID, a quarter of individuals with disabilities, 25.4%, said they experienced long COVID versus 13.8%. So basically twice as likely to experience long COVID. In terms of the population currently experiencing long COVID, 13.1% of people with disabilities reporting that versus 4.5%. So almost 3 times more likely. And one of the questions in the pulse that they added about a year ago was asking, okay, if you're experiencing long COVID, what is the impact on your activity? You know, so your typical daily activities, and and then asks how significant an impact has it had on you specifically due to long COVID. So this is not due to any other disabilities. Okay, what's happening after since you'd had long COVID and currently experiencing it? And 5.5% of all people with disabilities in the survey reported experiencing a significant activity limitation versus 0.7% of people without disabilities. So that's 8 times more likely for people with disabilities to be experiencing a significant activity limitation. So you can think about, you know, this sort of impact on the ability for a person to be able to comfortably work or, you know, do anything. You know, it's a significant activity limitation. So that's a pretty high bar to hit. And yet, you know, basically 1 in 20 people with disabilities, you know, are currently experiencing this. So sort of eye-opening. So this link in the bottom here, the CDC website, allows you to delve more deeply into looking at into the pulse data specifically on disability. So if people are interested in exploring that some more, it's a great source of information to see, okay, what are the differences between people with and without disabilities and how they're experiencing these different impacts of COVID. Okay, next slide. So just wanted to, so just again, disabilitystatistics.org is where you can get, you know, all of the ACS data, all these estimates. You can download the status reports. We have an interface which allows you to look at you know, prevalence rates by gender, race, ethnicity, age groupings, also education levels. So you can sort of delve and get really deep into into trying to understand, okay, and all of the estimates are by a national level as well as state, including Washington, D.C. and Puerto Rico. So if you're interested in, you know, getting more information, you can basically every year when I do this analysis, I develop about over 3 million estimates that go into this interface and allow you to be able to see what's going on in your state. We also have an interface on the ADA, on the Northeast ADA website, which allows you to look into more local data at the county level and look at prevalence rates and employment and other issues. So we can actually, that's available on the Northeast ADA site as well, which we need to update. And I'll be updating the ACS data for 2022 was just released this month. And so I'll be providing 2022 data, hopefully within the next, by the end of the year. So if people want to see new data, that will be available in the very near future. Okay, next slide. So if you have any more information, again, you can contact me through disabilitystatistics@cornell.edu. And if you have any questions or looking for more information about disability or trying to find data sources, I'd be happy to help out. Thank you very much for your time.
Pretty remarkable data. You know, our students have to do theses, they have to do applied practicums. I don't think most of our students at Global Public Health know about these rich data sources. I certainly didn't. Right? Danielle? These are data sources that I don't think our students, especially our FE students, Danielle, do your students know about it? It's a gold mine. And Bill, we really appreciate your enthusiasm for data coming from public health. It's music to our ears. Thank you so much for that. Really great. All of our speakers so far have been so informative and so fantastic. We really appreciate you taking the time to be with us today. Now we're going to go to the next slide. We are going to have a break. It will come around 10:30, and I do want to point, yes,
The Zoom chat is saying that you need a mic.
a mic.
Maybe someone at the front could open the Zoom call and on the, hear you.
Is it loud enough if we just speak louder? Is this,
Is it better right here?
Um,
Is it better on this side?
someone in the Zoom call,
There's, I think the mic is somewhere in this zone. If we stay right here. Well, anyway, we're going to have a break at around 10:30, and I want to point out we have one bathroom right here on the floor, but if you go out the door and take the elevator down to the 7th floor and then take a quick left, there's a long corridor. You'll pass a kitchen, and right past the kitchen, there's a handful of single-use bathrooms. But why don't we get started? I'll start us off if I could just have the next slide. Is that a little better, Kay? If I stand up here, maybe this side.
no, I think, does one of you have the Zoom call on your phone? Maybe you could unmute or.
sure, we can do that.
Oh, and also, we are going to tape today's, and of course, we are taping it. And we will have these slides with all these wonderful resources at the end of the slide sets. These Pacific ADA link to this fabulous new updated website that Jerry's been working on. I know the Northeast ADA that Bill was talking to us about will have all those links in a set of slides that will be, I guess, sent to all the people who register. Is that how we're gonna work the slide sets?
That's
That might-
correct.
That might be the best way, but we will have this also taped. I'm going to just introduce a little bit before Owen gets into our slide presentation and some of our data from some studies we've been working on the past 18 months. Okay, is that a little bit better?
Yes, they said that's a little bit better.
Okay, thank you so much. I appreciate it. We'll be talking about the ADA coordinators, their barriers and facilitators to ensuring equity. This study that we're conducting now, Owen and I, the past, say, 18 months, comes out of a broader body of work that I conducted with the former director of the Pacific ADA, Louis Krause. This is going back now almost 10 years. We started a study at that point because I'm in the field of emergency preparedness, public health disasters. In fact, this work is under the auspices of the Complex Public Health Disasters Lab that myself and my colleague Alexis Merchanoff, who unfortunately couldn't be with us today, I think she may be on the Zoom, the two of us are co-directors of that lab. In any case, about 10 years ago, I began a body of work that was looking at the role of preparedness for people with disabilities. So we looked at it from the perspective of people with disabilities. We looked at it from all the people that might be helping them, including the offices of emergency management and the ADA coordinators. And lo and behold, we found out that they were totally unprepared for any kind of disaster. And we were looking at specifically Region 9, which Owen will tell you a little bit more about, but that includes California. So we're talking about earthquakes, wildfires, heat, excessive weather, winter weather, all kinds of disasters in that region. And yet people with disabilities were very unprepared. And unfortunately, we saw with a number of serious wildfires of the last few years, just how unprepared they were. People with disabilities are twice as likely to be injured in a disaster event and twice as likely to die. If they recover, they are much less likely, maybe 10 times less likely to get back to baseline. That is housing, employment, finance, jobs, every which way you can imagine. So disasters affect them so much more greatly, just as we've seen from the incredible data that Jan and Jerry shared, and these wonderful stats from our colleague from Cornell. They are really at a disadvantage. There's an equity issue. So after we did that whole body of work, and I'm certainly happy to put up the papers that we wrote on that work when we send you the slides, but out of that came a nagging question for us. that just wouldn't go away. It was like an itch that you couldn't really scratch. And that was why? What is the root cause of these terrible disparities? And so we looked at the ADA coordinators on the next slide. We were particularly interested on the next slide to find out, was the role of ADA not clear? Did they not have the right training? Did they not have the right resources at hand? Were they not linked up to people with disabilities? Because we've seen from the incredible job that Jerry and Jan did that the laws are complex. The legislation is not immediately accessible to anybody, let alone people with disabilities. It's hard to get your hands on it. And I think most Americans really, frankly, don't know pretty much about it. We certainly don't learn about it in school. And education, advanced education in that area is not common. It's not common even in our school, in a public health school. So we thought, okay, let's take a closer look at what are the barriers for the coordinators, and that's what this study is about. As Bill so eloquently said, we have many different ways that we define disabilities. We're looking at CDC data as public health professionals. They are, the mothership, let's say. We look to them for our data, and they say that 1 in 4 Americans have disabilities, or roughly 61 million people. That number is only increasing because as America ages, as with many other parts of the world, and we're rapidly aging, this is going to be an increased problem because as you age, disabilities are almost inevitable. I read something yesterday that was a little scary. They said that after age 63, how they got to that number, I don't know, but they said after age 63 is when your health really starts to decline and that you start to feel old. So that's a little bit of a scary number for many of us. But CDC does collect quite a bit of data, as Bill pointed out on the next slide. You can see that, yes, there's 1 in 4, but it is not proportionate. It is not equivalent, and there are disparities and differences with Blacks and American Indians, Native Alaskans having the highest rates. I did read on the CDC website, and by the way, we will have a link for all of these, that people in the South, so Bill said the Rust Belt, CDC says it's the South, and those people are much, much more likely to have disabilities, 1 or more disabilities. And there are a lot of disabilities that are unnoticed. And we have to be mindful for that. And it was good to point out, maybe it was Jan that pointed out that people with an upper body disability would not be captured. I guess it was Bill, it wouldn't be captured because there's no category for that, for partial disability, permanent partial disabilities. On the next slide, so Owen, who is our graduate student doing a very nice work study program with us, and I looked at, what can we do in terms of finding out about this problem? We decided to, of course, we're in public health, we're in epidemiology, we said, let's do a survey. So we did a survey. One of the first things we found out, trying to just capture the contact info for ADA coordinators in Region 9, which is a huge region, millions and millions of people. Theoretically should be thousands, maybe tens of thousands of ADA coordinators, because any entity, public entity over 50 employees has to have 1 ADA coordinator. Well, lo and behold, it took us months to even come up with, do you know the final count that we had of the mailing list?
203.
After literally I'd say it was about 8 months of 2 people combing through all the websites. That is the first order of business, to be able to contact these people. If you have a question about your wheelchair or accessibility at work or employment issues, housing, any kind of issue, that's the first order, and that's what we came up with. So we said, okay, in this survey, and by the way, we did conduct several surveys. We did this one on ADA coordinators, one on people with disabilities and their advocates, and another one we just are wrapping up, that's all of the US ADA centers. We said, what are some of the organizational and individual barriers to fully implementing the ADA? What is the role of the ADA coordinators? Should they really be helping people to fully implement this ADA? Who are these ADA coordinators? What kind of training or education do they have, or what kind of experience? And how can we measure and predict the effectiveness? Because obviously, at the end of the day, we'd like to develop an intervention. On the next slide. And then we move into Owen sharing the data with you. These are our key research questions. So I'll turn it over to Owen now.
All right. Hi, everybody. I'm Owen. I'm a graduate student researcher. I've been working with Dr. Gershon since last year to put together this survey and part of this broader study on ADA coordinators in Region 9. Again, working with Pacific ADA Center has been great. We developed this key research question, understanding that there is a large proportion of the United States who has a disability. We want to understand, for the people whose job it is to ensure that the rights are protected for people with disabilities, what helps them and what hinders them. Before I came to NYU, I worked in the field of ADA coordination back home in Portland, Oregon, in the Portland Bureau of Transportation, where I was first exposed to the work that needed to be done for people with disabilities, and heard from people who had years and years of trying to get access and accommodations that they needed and were entitled to under the Americans with Disabilities Act. So understanding this work a little bit myself, this made this research more meaningful. If you go to the next slide, please. Our study, again, was focused on Region 9, which is Arizona, California, Hawaii, Nevada, and the Pacific Islands. And we recruited a convenient sample of ADA coordinators. Like Dr. Gershon mentioned, our colleague at the Pacific ADA Center and our colleague here as well, Molly, worked to gather contact information, which was really the first line of investigation. How easy or difficult is it to find how to contact ADA coordinators in the first place? Our study ran from summer to fall of this year, and we ended up closing it at about 71 respondents. And this study did have human subjects approval. Next slide, please. As I mentioned, we had a small sample of 71 respondents. This group is 60% female, 65% white, 68% non-Hispanic or Latino. The majority are over 40 years old. And most interestingly, I want to mention the next bullet point, that almost 40% of our respondents do identify as somebody with a disability. This is higher than the general proportion of those in the United States. We mentioned it's about 1 in 4 adults in general who have a disability. So in this position, there is pretty good representation of people with disabilities, at least higher than we note in the general public. There's a very high degree of education among this group. At least half have a graduate degree, and 93% had at least a bachelor's degree. And then finally, in terms of income, we saw that about a third, unfortunately, are making less than $50,000 annually. So this highly educated group is not always being paid commensurate with their education, and certainly not with their effort in many cases. Next slide, please. We also have been noticing, both anecdotally and in our survey, that ADA coordination is not a standard formalized role. There's not always a title, ADA coordinator. There's a lot of people who do ADA coordination, but without the formal title or training. And so we saw this in our survey. 82% of respondents said that ADA coordination was just one part of a much longer list of responsibilities. And sometimes people had the time to give this the effort it required, and a lot of times they didn't. A lot of times it was tacked on to a list of responsibilities as just a checkbox or a series of checkboxes to make sure that they weren't doing anything against the ADA, but a lot of people didn't feel they had the time to actually proactively ensure they were providing accommodations. We saw that just 34% of people, 34% of people in total had just 0 to 3 years of experience in ADA coordination, and 15% of our respondents had actually less than 1 year of experience. And about 40% of people prior to the job that they have currently in their current role had any sort of ADA related job. So on the whole, a lot of our respondents did not have a lot of experience in the ADA coordination field. And we saw people responding from a wide variety of departments. Those you would expect: public works and transportation, human resources, but then also those who do ADA coordination in less traditional roles, aviation, IT. This brings to light the important fact that ADA coordination is not just in a set series of sectors. It is part of every job, it is part of every sector, and there's a lot of people who are underrepresented. Next slide, please. We also asked what qualifications people in their jurisdictions needed to assume the role of ADA coordinator. And so about 37% said they had completed 40 training credits for a certification program. About 30% said they'd completed some sort of ADA basics course. But most interestingly, I want to call to your attention this 28% of our respondents who said that there was no formal training or education required for their ADA coordinator position. Over 1 in 4 people are indicating that they have no formal job training. And again, this brings back to our point that this is a non-standardized role without formal training or education. Next slide, please. Generally, what we are finding is that there's a lot of ADA coordinators who are feeling disconnected and ineffective. So just 40% indicated that they feel very effective in ensuring ADA access within their jurisdiction. Just a little over a third agreed that they felt they were ensuring inclusivity. A little under half said they felt well connected to other divisions or groups within their organizations, which may well affect their synergy with other groups and how well they can deliver accommodations across multiple departments and sectors. And then most importantly, just 20% of respondents said they actually feel well connected to their local disability communities. Next slide, please. We looked a little bit at how the actual work environments might contribute to some of these findings. 50% of our respondents, just about half, said they feel well supported by their supervisors and managers, and only 30% said they feel they receive appropriate recognition for the work they do. A little over a third said they have a well-defined set of responsibilities, and this is a particularly important point because, as we've been harping on, there's not a lot of standardization in these positions, and when people do not have a well-defined set of responsibilities, it affects how meaningfully they can uphold the rights and their particular responsibilities under the ADA. We saw that about 40% of our respondents indicated feeling burnt out. And what does this lead to? Well, 1 in 4 of our respondents said that they would most likely leave their current position within 3 years, indicating that there's a fairly high turnover rate in this position. Next slide, please. This is, though, an optimistic group, and it is one that, despite feeling some burnout, feels they can still accomplish good things. Nearly 70% of our respondents said they've accomplished many worthwhile things in their positions. And additionally, a lot indicated that ADA coordination can be a meaningful and fulfilling career. Next slide, please. We looked at those specific factors that had significant associations in our data with our outcome, which was self-efficacy. And so the factors we list here had significant statistical association. Those were receiving adequate training through one's organization. Again, keep in mind, 28% of people said they'd received no training. Number 2, having a seat at the table to advocate for their department and group's budget in larger group meetings, where they could advocate for the resources they need. Number 3, belonging to a peer support group. Again, getting back to this feeling of disconnection, very important to show that it's meaningful that people have other ADA coordinators, preferably those with a lot more experience that they can rely on and use as sources of help and wisdom. The next bullet point being they need a well-defined set of responsibilities. If this group of people is to ensure the accommodations and rights of people with disabilities under the ADA, they need to know specifically what they're responsible for. And so this is reflected in our data that those who indicated having a well-defined set of responsibilities had a significantly higher degree of self-efficacy. And finally, feeling well integrated and connected to your entire organization beyond your individual work group is again significantly associated with feeling self-efficacious. Next slide, please. To bring to light a few limitations of our survey, we had a relatively small sample size of just 71 ADA coordinators, which certainly limits the generalizability of our findings and the overall study power. Because we used a convenient sample, it's also certainly possible that we have an overrepresentation of well-performing ADA coordinators, those who have the time and knowledge to fill out this survey. And of course, it's also possible that due to the way we solicited responses, we might be underrepresenting those who do ADA coordination work, but in non-traditional roles, those we might not have found by looking for ADA coordinators. Next slide, please. And as Dr. Gershon mentioned, this was just one in a series of 3 studies that we are conducting. We're right now just wrapping up a similar survey that is nationwide, not just in Region 9, with a very similar number of responses. And this will allow us to see whether we see similar findings across a national sample as we see within Region 9, sort of the southwestern United States. We're also completing a study of people with disabilities as well as their caregivers and families. Because while we're interviewing ADA coordinators, we want to see what the experiences of people who are actually reaching out to them for accommodations are like. And then finally, the end goal, of course, is ensuring that we can provide recommendations to support ADA coordinators to boost their efficacy and ultimately work toward full implementation of the Americans with Disabilities Act. Next slide, please. And just to thank all those who have taken part in the study, of course, we want to thank every one of our participants who provided invaluable feedback and took time out of their days. We want to thank our partners at the Pacific ADA Center, Jerry and Jen, who just spoke, and Gabe, who took a large part in finding our mailing list in the first place. Of course, everyone on our study advisory board provided invaluable feedback on our survey. And then again, to mention our funding source, we have a subcontract from the Pacific ADA Center through the U.S. Department of Health and Human Services, Administration for Community Living. And thank you very much.
Okay, great. Welcome back. Okay, we're going to start our panel now. First, I'd like to introduce some of the panelists, by the way, on the program, which we will also put in our mail out to you and the contacts list, right? Name and contacts. So you'll have more of this info. We have Wanda Cook, who is a research associate at the Yang Center up at Cornell. Thank you so much for being here with us. We have Lainey Davison, whom we know for several years, and we now know she has her own firm that maybe she'll tell us a little bit about later. Thank you for coming and joining us. And we have Jan again. It's great to see you, Jan. And we have Wendy Strobel, terrible names, Gower, who is the director of the Northwest ADA Center, and lots of other wonderful titles. And welcome to all of you. We'll start off with the first question that was provided by Jerry. Hey, Jerry, you want to come sit up here with me? First question is, I think we've answered this one already, so it'll be easy for you. Has the promise of the ADA been fulfilled? And why or why not? Why don't we start off with Lainey and let's see what she has to say about that. Has it been fulfilled, Lainey?
Thank you so much. Is everyone able to hear me okay? I've been having mic problems.
Yes, it's great in here.
Okay, perfect. I've also been a little under the weather, so I might be clearing my throat. Apologies in advance for that. Hi, everybody. I'm Lainey Davidson, the Disability Access Manager for the County of Marin, which is a county just north of San Francisco in California, and also have a consulting firm, LC Disability Consulting. I'm a white woman with brown hair with blonde highlights, and I'm wearing a white turtleneck sweater. It would appear I'm very cold, but I know compared to the weather you all have out there that Californians can't complain. So I won't do that today. So has the promise of the ADA been fulfilled? Why or why not? There are definitely successes of the Americans with Disabilities Act, right? It's the first comprehensive civil rights legislation for folks with disabilities, and it sets the framework. It made possible the creation of many federal and state regulations that changed the lives of people with disabilities living in the United States. Things like the ADA standards, the U.S. Access Board guidelines and standards, state building codes. So all of these have implemented wonderful progress for accessibility. And a lot of that progress can be seen in the built environment. There's still more work to be done, but progress for sure is visible in the built environment. And we can see the tangible results of those efforts, right? So it's a good way to benchmark progress. The areas where I still see the promise largely unmet are the programs and services arena, also with social and systemic barriers. So arenas like employment, community-based services, the understanding and combating of ableism, looking at ableism from an intersectional lens. These are all areas where a lot of work has to be done. And Jerry and Jan did a great job of giving us a framework and a background on the origins of ableism and the history of disability rights, and where the gaps still exist. So if you do a quick Google search of organizations that serve folks with disabilities and represent folks with disabilities, and you say, if you just Google, has the promise of the ADA been fulfilled? I couldn't find one organization that said it had. So they all say there's much work to be done, although we have success to celebrate for sure. There's a lot of work to be done. And then finally, for the 30th anniversary of the ADA, the New York Times published an article by John Wadach, who is a former Department of Justice lawyer and the chief author of not only the ADA, but Section 504, and Judy Heumann, who most of us know, an international disability rights advocate. She was also the leader of the historic 504 sit-in in San Francisco in 1977. And I just want to quote, since these are two foundational leaders in the disability rights movement, some words they shared in that article to this point. Many of the injustices that the Civil Rights Act aimed to eliminate are still very much with us and still being resisted. The full promise of the Americans with Disabilities Act has yet to be realized. We are not yet where we need to be. And then they go on to say that emerging solutions ignore the needs, issues, or concerns of disabled persons. In most cases, we remain an afterthought. That invisibility persists at least partly because so few disabled people are in leadership positions in government, business, and education. We are rarely in boardrooms, featured in TV shows or movies, or occupying positions of political power. Requirements like making playgrounds and movie theaters accessible, providing sign language interpreters in emergency rooms, or accessible websites for registering for community programs have been life-changing, but only when people with disabilities routinely work and play alongside their fellow citizens will deeper change occur. So I see that, through these words, they're sharing with us that combating ableism and integration into life are key for continuing to move the needle.
That's great, Lady. Thank you so much. Appreciate it. All right, another question is, what are some of the solutions or steps moving forward to reach that potential? Why don't we ask Jen what you think about that? What are some of the steps we can take?
Thank you. Well, I think there are many steps. One is to better educate the public about disability and about disability rights and what is going well, what isn't going well. And, despite the fact that the ADA is actually 33 years old, which in some ways seems young and in some ways seems old in terms of a civil rights law, despite that fact, we end up talking to people every day who don't really know what the ADA says or requires. Employers, state and local government agencies, people like Lainey was saying, movie theaters, all kinds of public accommodations where the people might go. And they really don't know what their obligations are. They don't know how it can benefit them to have people with disabilities come and spend their money and participate in their programs. And that is really, a shame that they don't understand that. And so I really feel like there needs to be much better education about people with disabilities, about the needs, and about how much we have to offer society as well. I know one time I was on a panel of people that were talking about employment, and I said, they were talking about entry level employment and the statistics of people with disabilities they had at that level. And I said, so how many people are in middle management or upper management with disabilities? How easy is it for people to be able to be promoted and move up the chain? And they kind of went, and they literally did not have an answer for that. And I just feel like, we're relegated to the bottom of the ladder, and the ladder is, of course, not accessible. And so, it really still needs to change a lot of attitudes about disability, a lot of awareness, and also awareness even of the ADA National Network, we continue to be one of the best kept secrets in the country in terms of our knowledge of the ADA and other disability rights laws as well, and how much we can help people understand them. And I just feel like we need to get the word out about our existence and about what kind of benefit people with disabilities bring to the table, to every table, and making sure that that table is accessible.
John, that's great. And we should point out these websites from the ADA centers are amazing resources. And unless you specifically are looking for it, you could miss it completely. And by the way, a lot of people have temporary disabilities that may need some accommodation. They could get information from these websites or their independent living centers. It's an amazing lack of knowledge on the part of most people. One question that came up was to maybe have you talk a little bit about things that you've done. Why don't we pass that over to you, Wendy? to help
Sure.
Improve inclusion and equity.
Yeah, and I think one of the roles of the ADA centers is really to increase knowledge and implementation of the ADA in communities, right? So how do we help people understand what their rights are, what their obligations are, to understand that this is really an equity issue.
Can you speak up or move to the
Closer to us.
Sure.
Look fabulous, Wendy.
Thank you. Can everybody hear me now? All right. So it really is about implementation of the ADA. And so a lot of the work we do as ADA centers is engaging people in our communities through training, through technical assistance, through just getting people involved in the ADA and what it's about to help them implement ADA in their own communities. Implementation of any civil rights law is really about culture change. You say you have to include all people. Well, what does that look like and why should I? Right? And that, I think every marginalized group in America will say that they have felt this at one time or another, right? So doing that education piece, as Jan said, is really critical because if people don't understand why, they will never do it. And people don't change because Cornell or someone at the Pacific ADA Center or some other external institution says I have to, right? They change because of communities. I want to highlight a program that LaWanda runs. It's called the Trainer Leadership Network, where we train people so that they can advocate for change in their local communities. The data tools that Bill mentioned that we have on our website for the ADA Center are for county level statistics. So you can say, what does ADA implementation look like in my community? How are people being included? How big is the population of people who are impacted, right, in my community? Because when you go to a policymaker or when you go to someone in power who has control over how we implement the ADA, you need data. You need the information that says, here's who's impacted in your own community. Here's how they're impacted. There's another site that's run by the Research Coalition for the ADA National Network called ADA Park that looks at things like transportation and food deserts and all the other surrounding issues that go with a marginalized population like people with disabilities. What are the real disparities there so that people can actually advocate for change? So we try to provide tools and resources so that people can make change locally in their own communities, but also give that support. We run a technical assistance line. I've experienced discrimination, or this happened and it didn't feel good. What does the ADA say? The ADA is really complicated. The data for ADA coordinators is frankly terrifying, right? Because often the answer in the ADA is it depends. And it's always the specific set of circumstances, right, that the person finds themselves in. And you have to be able to do that analysis in a systematic way in order to make the necessary changes and understand how to implement the law or how to assert your rights. The other thing I want to point out is that there's a cost, right, to even identifying as a person with a disability. And so many people with disabilities, me among them, can hide. No one needs to know that I have a disability.
and you're treated differently, right? And in an employment situation, you might not be hired, you might be fired, you might be coached out gently. You're just not a good fit here. Or don't you think you'd fit better somewhere else? You know, those little subtle things have impact. So if you're afraid to even say I'm a person with a disability, how do you advocate in your community? If you file a charge in your community, everybody knows it was you and that you're asserting your rights as a disabled person. And that changes people's perception. And so it's a constant battle, as the earlier respondent said, to understand what is disability, that it's full citizenship is the goal. And one other thing, last thing I'll say, I promise, is that the ADA is really a floor, right? It's non-discrimination. So if we can't even get to where the ADA, the non-discrimination piece, how do we get to that full promise piece, right? Full citizenship. And that's really what we're going for.
Can I throw in a follow-up
Yes,
question
you
to this?
can.
We've talked a lot about the ADA and its promise, and you touched on this a little bit, but we haven't talked about like what enforcement of the ADA looks like and maybe why we haven't fulfilled that promise. So if you want to touch on that a little bit.
You know, it's tough. I was at a conference yesterday for people with intellectual and developmental disabilities. We did a presentation, a few of our ADA centers joined together, and we said, how many of you know about the ADA National Network? In a room full of people who support people with disabilities, no one knew. It's a different network, right? But they didn't know. And it's just nuts to think about. So that whole group of advocates hadn't been activated to think about ADA implementation. Things only change through advocacy or through complaints. The ADA is enforced through individuals making complaints against entities. Often the power imbalance is really clear. If I complain against my employer, I am one person fighting a very highly resourced entity who has lawyers and bureaucrats and all kinds of layers of protection, whereas just me going, I have a right to this. I have to file a complaint with the Department of Justice or the EEOC, and I have to hope that that gets investigated and enforced in a reasonable time frame. Sometimes the threat of a complaint is enough to inspire change, but oftentimes it's like, yeah, well, we made this decision and that's our decision. And so it's a really tough thing to get change to happen. And that's why we push so hard for advocacy, because if enough people say full citizenship is our goal, and here's how you do that, here's what accessibility looks like, and here's what thinking about universal design looks like and the impact of that, then hopefully we won't have to get to the complaint threat phase, right? Because no one changes because they have to comply. They change because it's a value that they hold, that all people should be included as part of the community.
What about class suits when it's against like a whole city? Because I know New York City has had some of those.
Yeah, so that's a group of advocates banding together to say, no, this is not okay. And again, it goes back to that advocacy that a whole group of people had to stand up and say, this is not right. You need to change. Here's the change we demand. And then that eventually makes it through the court systems and all
Maybe
that
10
kind of
years
stuff.
later.
10
Yeah.
years later.
Well, this is the subway elevators, by
Yeah.
the way. The MTA is saying, oh, yes, we're gonna comply, and we'll do it in 30 years.
In 30
Over
years,
30
you can ride the
years.
subway. You'll be dead, but it'll be accessible, right?
And this is Jan speaking. Can I interject something? I just really quickly, I'm sorry. And that even when you do those class action lawsuits and other litigation, the disability community gets absolutely vilified for doing that in the press and saying, well, these are just people that are trying to get money. These are lawyers that are trying to get money. And that is the way the ADA is enforced, is through private lawsuits and private complaints. I mean, government complaints, as Wendy said, and yet we get vilified for trying to enforce the law. So that's a big problem as well. Sorry to interrupt.
Not at all. So why why wasn't there some enforcement built into the ADA? Like even with OSHA, very weak, very, fluffy, but at least even with OSHA, you can get fines, serious fines, and you can get complaints, you can get investigation, you can have a fine. But ADA didn't.
Yeah,
have that
and
built
maybe
in?
you want Jan to answer this. She's a lawyer, and can probably do this more politically correct. I think the ADA was a compromise. The civil rights era that was happening. Disability rights started with the Rehabilitation Act of 1973, right? So people standing up and saying, what about education? This is the federal government. Shouldn't you have a right to include everyone? And sit-ins and protests to assert rights, where really the whole civil rights community banded together to support disability rights. Getting a law into place was really a huge struggle and a huge compromise. You look at some of the provisions, for employment, and it's really a compromise. Well, this is how far employers were willing to go, that you end up with a law that's enforced by complaints. If something happens to you, then you should have a right to stand up and say it. And to some people, that feels fair, right? When you're not the person with no power, that feels incredibly fair. Because of course, if someone comes forward, I as a person in power will react responsibly and do the right thing, right? That's the dream. It's not the reality. and so I don't think that they thought it had no enforcement provisions. I think they thought that people would do the right thing. I think after 33 years, we realized that's not always the case, right?
No, there was something missing. And the piece missing was, here's this law, here's this wonderful law in the books. Here are all these people that need some accommodation or some help. But getting those two to meet would have been, I think, maybe the ADA coordinator. Let's ask LaWanda, who's sitting there so patiently, where's the problem? Why should the ADA coordinator be that link so that you don't have to step up and be out there all by yourself telling your employer, I need this accommodation, I need this or that or the other thing? Who should be doing that?
Well, I don't do a lot of work directly with ADA coordinators, but I can say that we need to look at a system that actually put the responsibility on the person that's already victimized and already challenged to be the one to do all the work that might allow for the law to actually be to their advantage, right? So that's problematic. And I think that's what Wendy was alluding to, is we have a structure that suggests, well, if you have the right to speak up for yourself, then everything will be fine, right? But that we know that's not true for every community. We know that there's disparities in terms of how different people, when they speak up for themselves, to Jan's point, are treated, right? So marginalized folks who are part of marginalized groups don't have the same outcomes typically when they speak up. So leaving that responsibility solely on the person with a disability is super problematic. And I think it ties back. I think we want to pretend like we don't have to deal with the stigma thing, but the answer to all your questions is stigma. And the reason I say that is even this week, the project that Wendy mentioned a few minutes ago that I run for the national network, where we work with people to do ADA training at a local level and implement the law locally. I got a call from one of our members, and she said she has an employer who has a bunch of employees with disabilities who've been accommodated, and they have colleagues without disabilities who are very bothered by the fact that some people are accommodated. The non-disabled colleagues feel like their disabled colleagues are not pulling their weight and are getting unfair advantages in keeping their jobs. The request of our trainer, who actually works in public health, was could she come in and talk to the non-disabled employees about the people with disabilities that work there? No, we need to understand that this is not an unfair advantage. This is a legal right for people to be accommodated at work if they meet the qualifications for the position, right? But part of that issue is we do have stigma, and we do have culture change that needs to happen in workplaces, in communities, in classrooms, all of it. So I think that's really what we need to be looking at. I think we want to find a simple solution to a problem that's not at all simple. Disability is complex, civil rights activation is complex, and even how we view the lived experience of human beings when we pretend like disability is over here somewhere, right? When really it's just part of lots of people's bodies and minds on a regular basis. And we do have, you know, to Lainey's point, we do have leaders and other people with disabilities all over the place. But to Wendy's point, we don't know that because we don't feel comfortable speaking up. We're everywhere. But with the stigma, you won't know about some of those role models we would have because there are those consequences that happen. So with enforcement, we have to share the load. The whole point of the ADA as a major civil rights legislation was to really look at that social model of disability and how disability is really about a mismatch between the resources that the individual has, whether they're cognitive, physical, emotional, and what their environment is requiring of them. And the ADA says everybody's responsible for improving the situation so that all citizens can move about and do things on a regular basis, daily activities, without undue burden or barrier.
Oh, well said. Thank you. Lainey, I think I saw your hand was up.
Thank you. I just wanted to add, I know that we had the wonderful data shared about ADA coordinators and their experience in Region 9. And I would add to that, you know, the ADA coordinator position is a federally mandated job. All municipalities with 50 or more employees are required to have one. I think that one of the gaps left out is the enforcement authority. So there's a ton of responsibility with the job of an ADA coordinator and zero authority. And oftentimes, as the data from the study showed, you know, ADA coordination is just another duty as assigned. Many people are voluntold. Congratulations, you get to be the ADA coordinator because it checks a box. Now we're complying with our federal mandate to have an ADA coordinator, but there's no required education or experience. Oftentimes, there's no support. We are more often than not offices of one or very small offices. There's no consistency about where within the organization the ADA coordinator is situated. So for instance, in Marin, I'm in the Department of Public Works. Even though I have countywide responsibility for ensuring that the organization is meeting the mandates under the ADA, but the other departments don't fully understand that. So, you know, not having the ADA coordinator in the city manager or the county administrator's office is problematic because there's a misunderstanding of the role. So I think that not just because I'm an ADA coordinator, but in general, that, you know, the fact that ADA coordinators are horribly under-resourced is a big problem. You know, when I receive complaints from the public or program modification requests, or I'm assisting with a reasonable accommodation request, there's no independent decision-making process. If I receive a complaint about my supervisor and I'm in the Department of Public Works, that's a conflict of interest. So, you know, there's a lot of problems about the situation and the plight of the ADA coordinator that I think directly impact implementation of the ADA. And I've been really trying to lift that up. You know, the Pacific ADA Center and I helped start this California network of ADA coordinators. We meet monthly, and this is a consistent experience across the state with folks that serve in the role. And so I think that that's a large problem. And then also just understanding that disability doesn't exist in a vacuum. And I think that, you know, the younger generations are doing a really good job of looking at things through an intersectional lens and expanding, you know, ideas about what ableism means and how to define it beyond those traditional siloed frameworks, I think is really helpful in educating the public, not only organizations, but the disability community about, you know, how to engage everyone, how to get advocacy and activism reinvigorated, and to continue the disability rights movement work that so desperately needs to be done.
Absolutely. You mentioned something about the city manager, and so I've often thought, would it be just simpler to just say every city manager or mayor's office or, you know, at some high level, that's where the ADA coordinator should be working out of? Wouldn't the higher the office, you know, wouldn't that be the best kind of placement for them?
I believe it would be, yes. There's a lot of internal discussion around where the ADA coordinator should be placed. Should there be budget made available to them? I think that if it was a federally mandated situation, within the organization, that would be incredibly helpful because it would eliminate that whole, part of time of employment for the ADA coordinator doing that internal advocacy for recognition and resources. It would eliminate that. A huge part of the ADA coordinator role as it's currently situated is that we're advocating for resources and authority. If we were given that off the bat, that part of the job would be taken out and we could really focus on serving the disability community and ensuring that the organization understands their responsibilities, which is what we're supposed to be doing as internal consultants of sorts within the organization.
An important point.
And I just want to make a clarifying point here too, is that we're talking a lot about ADA coordinators. Those are specific to government agencies. And so, their realm of enforcement, if they have enforcement authority, like Lainey mentioned, that can be rare, but that is kind of their area. So when we're talking about private entities and private employment discrimination, ADA coordinators, that has no intersection there. So they don't really have the authority to go in. And I just want to make sure that since this audience may be new to ADA coordinators and disability rights and the ADA, that we recognize that that's just small scope of enforcing the ADA.
Well, let's use NYU as a sample, right? So this is private university, so different from, say, CUNY or SUNY. So we're private. We have a very active Office of Disabilities Rights, accommodating students and faculty and staff. So if somebody feels that they're not getting the accommodation here, they go to that person, but is there another recourse?
Yeah, so, and Jan, I see your hand raised over there, and so did you catch the question there? Because I'd love for you to talk a little bit about private entity ADA enforcement.
What can they do
Yeah,
to
absolutely.
get their accommodation?
Sure. And I know, anybody could speak to this as well. So even though it's not really mandated in the regulations for any other entity to have an ADA coordinator, many large private entities do indeed have ADA coordinators, especially private universities, private corporations that are large. And then a lot of people do have Title I or employment ADA coordinators as well. So just because it's not mandated doesn't mean it doesn't exist. But often what happens is, even in the Title II, the state and local government agencies, they will put that person in the employment section of the state or local government. And so really all they know is the employment part of the ADA, and they're not enforcing the external facing program issues for the state or local government. And so there's a big problem with placement. What really has to happen, though, in order to do that is to change the regulations of the ADA. And that is a major undertaking. That takes a very long time. And if they're going to change it for this, they're probably going to want to include a lot more things in the changes to the regulations. So that would take years to happen. And so that's a problematic part of this, is that this is basically regulation, through the law. And, it just says, in fact, it doesn't even talk about the term ADA coordinator. It just says a responsible person, right? And so what does that mean? And so that's a pretty big problematic part of this as well. So I think, I really feel like the Department of Justice needs to try to get more funding, get more personnel that's working in the disability rights section to enforce the law, so that they are out there actually coordinating enforcement throughout the country as much as possible. Because right now they have a tiny staff who is not really able to go out and do a whole lot. And politically, when the political, lead changes, the problem is that, if it's a different administration, they may not do any enforcement during that administration. So it's a big problem for enforcement, and a big problem that, like Lainey was saying, that nobody knows where the ADA coordinators should be and what kind of power they should have.
Yeah, you took the words out of my mouth about how prioritization of DOJ complaints changes with presidential administrations and how they prioritize that. Wendy, I think you wanted to add.
Yeah, I didn't have a raise hand button, so I actually had to raise my hand. But I think one of the issues of having a responsible person is that then it becomes one person's job, right? To include people with disabilities, one person. And these organizations, they're huge. One person can't do it. A lot of what we do on one of my other projects, the Employer Assistance and Resource Network on Disability Inclusion, is talk about whole organization accessibility, right? How do you get it to be everybody's job? You're having an event? Great. What do you have set up to be inclusive for people with disabilities? You're creating a document. Great. Is it accessible? Can everybody read it? You're buying a new piece of technology that you're going to implement through your HR systems. Can all of your employees use it? What about future employees? So how does it get to be everybody's job? And whatever their role in an organization, in an employment situation, in a county, that we all play a part in accessibility. Imagine in an organization, if non-discrimination for a group of, say, Hispanic people or Black people, the only one who cared about not using offensive language or not treating employees of color differently was one guy in an obscure office somewhere, right? That's not going to work. It doesn't work for disability either. Everybody has to care, and everybody has to contribute, and everybody has to make a difference. So how do we get people to recognize and realize and embrace their role in equity in organizations for everybody? Tying it back to our theme for today, yes, disability is part of DEIA, often not included, too often, but it is part of it. The federal government just released an executive order that actually adds an A, right, for accessibility, so that we're thinking about that constantly. What does accessibility look like for everybody? And right now, we're not there. It's not happening.
No, but to have that kind of whole community, which I love, by the way, that's a concept for emergency management. The whole community has to be prepared wherever they are in every which way. But there are no resources to do that. You still need somebody in the organization that can guide them.
Sure, and I'm not saying guiding is a bad thing, but sole responsibility is too much. It's not reasonable. So ladies, other duties as assigned is to make sure that everybody and the whole organization thinks about accessibility. Good luck, Leanie. You know, it's not, I mean, you might be a superhero, but it's not realistic, right? Everybody has to play a part.
Well, if you were a new student starting out and you were in the field of public health, and here they are very pro, the public's health in every which way. As far as I know, I could be wrong, but I do not believe right now our school has disability courses, let alone a track or anything. It seems to me that it should be, it might be, even one day maybe it will be, but in the interim, what kind of message can we give our young students? Where can they get the training they might need, or just to enhance their awareness or professionalism? What's the resource?
I think anytime you're working to improve the lives of people, you have to engage and interact with those people, right? What are your lived experiences like? What are the challenges that you face? If you go and talk to people with disabilities about healthcare and public health, right, people, you will find a whole big mess of a lack of access. You call a doctor's office for an appointment and they say, oh, I'm sorry, we can't see you here. Or we can see you here, but you won't be able to get out of your wheelchair. Or we can see you here, but you're gonna have to bring your own interpreter. Or we can see you here, but you're gonna have to bring someone to read all the documentation to you because we don't have time for that. You know what I mean? It's a whole set of issues of a lack of access. And what that means is shorter lifespans, disparate health outcomes. I mean, I can't imagine, although people tell me a lot, the extra burden of going through the world with disability, right? How much harder it is to find a dentist, to find a doctor, to get the care you need, to be seen for your issue and not for your disability, right? Say, I think I have strep throat. Oh, well, I see her in a wheelchair. What does that have to do with anything? I have strep throat. You know, to be seen for yourself and your condition and to be seen as a whole person and not as one part of your identity. It's kind of nuts. So I would say start with talking to people with disabilities. Hold a round table for your students, you know, of people with disabilities to say, let's talk about your experience and healthcare. It would be fascinating.
We actually have a panel like that that's based out of the Pacific ADA. It was taped, and that's where Richard DeValda was in on that panel, a few others. And we show it in my disaster courses because that panel was talking about how to be prepared, like what you can do
Right.
individual level. And the barriers were phenomenal. And it reminds me, Jen, you spoke to the class very eloquently about the issues you had during COVID and getting, I guess it was the COVID testing or COVID vaccine, I can't remember. But the barriers were life and death. I mean, they're issues of that magnitude. Jan, would you like to share again for us, for those who missed that in the course?
Well, during COVID, the specific thing was we all got vaccinated, right, relatively early on, as soon as the vaccines were available, and I certainly did. And I went to a drive-through vaccine center in Berkeley, where I live, okay, which was what a lot of them were. And went through. My husband was driving. I have a van with a ramp, but I don't drive because it's very expensive to equip a van for me to be able to drive, which I cannot afford. So he was driving. I was sitting in the back. We drove up. The nurse. We opened the door, the sliding door of the van, and she gets in and she sees me. And I say, "Well, I don't have an arm, so you can't put it in my arm." Okay. And she like gets a deer in the headlights look, and says, "Let me go consult with my colleague here." So she goes like behind the tent that we're, in, and obviously, and then two nurses come out, and they both get in the car. And I say, if you give it to me in my hip, I get every other shot I get in my hip. Why don't you give it to me in my hip, and then we'll do one in the left side, and then when I get my second one, we'll get it in the other side, just to make sure that it's not too much on one side. And why don't we do that? And so they conferred, and finally they both said, "Well, yeah, I think we can do that." And so in the end, common sense won the day. But I also was somebody who knew how to advocate for myself, who knew what I needed, who could say, "This is where I get shots, and this is, I need you to do my vaccine." And to this day, I cannot get boosters at a pharmacy. I have to go to my doctor to get a booster because the pharmacy people are not trained and they will not give me my booster in my hip. And so it is still a big problem to be able to even get vaccines for COVID, which, as Robin said, is a life and death issue potentially.
Lawanda, I know that a lot of your work has been in kind of the intersection of disability and race, and we're talking about some of these barriers. So I'd love to be able for you to expound on that and disability in the DEI sector, DEIA, as we're trying to evolve to, and just hear more about your expertise there.
Thank you, Jerry. Some of the things I was going to talk about, you've addressed already today, which is great. And the first is that when we're talking about folks with disabilities, it's not just that that there are other kinds of identities too. It's the fact that every person, whether or not they have a disability, has multiple social identities. Everybody on this, here today has a gender identity. Everybody has a level of educational attainment. Everybody has a social economic status. Everybody has multiple social identities. When we're thinking about intersectionality and disability, we need to recognize that disability is a marginalized identity. It is an identity that has been stigmatized historically and disadvantaged in all the ways that we mentioned. And when folks have disability and other marginalized identities on top of it, their experiences are not only sort of not only compounded, but they're actually changed. They're actually different, right? So this term intersectionality, which was coined by Kimberly Crenshaw in the 80s, really recognizes that it's not just compounded issues, but different experiences. This is why it's important to talk to folks with disability and other identities to actually hear from them what their experiences are. But in the work that she did, which at the time did not look specifically at disability, but just to help you understand the concept, she was looking at employment discrimination against Black women. And there was a particular case that she looked at. It was an automotive company, and that company hired Black people, but they were Black men. All their Black employees were male. The company also hired women, but it was only white women that they hired. So white women and Black men worked at the company, but Black women could not get into that company. And what Crenshaw realized is, wait a minute, the law is looking only at one identity at a time. So when they tried to file a claim, the court said, you can file on gender discrimination or race discrimination. But if you try to go with gender, we know there's women there. They just happen to be white women. And if you try to go with race, well, there are Black people there, but they're men. So Black women actually had a unique experience that occurred because of the combination of their marginalized identities. And that's why when we talk about disability, we need to recognize that also, right? So disability is one piece, but for myself, for example, I'm a Black disabled female, also older worker. Like I have lots of stuff that could be going on. And I have lots of situations where I can't tell which identity or which combinations of identities might be at play. And I'm trying to figure out what's happening, why a certain type of discrimination might have occurred, right? So this is the kind of thing that I've tried to bring to our work at the Northeast ADA Center and within the Yankean Institute more fully. So I have taught some disability studies courses and created a course around disability and intersectionality, or actually intersectional disability studies, we call it, because it's not one or the other. Disability is an intersectional identity. So intersectional disability studies, but also looking at other work that we do. So one of my projects is designed to improve outcomes for young people with disabilities who are involved in the justice system. And so looking at different kinds of inequity. So justice system involvement is a type of marginalization. It's a marginalized social identity along with disability. And then in some cases, we also see racial differences and socioeconomic differences. So we're looking at things like that in our work. And we have a few studies now with our ADA Center that are specifically highlighting those intersectional considerations, particularly around employment. We're doing some work with our colleagues in Region 5, the Great Lakes ADA Center, to look at the employment experiences of multiply marginalized folks with disability. So it is a huge topic, and it's not new. The concept is not new. And just like disability being only recently added to the diversity conversation, these issues have been true for folks just living and doing since the beginning of time. But one of the things we need to, again, think about is how often we distance disability and other marginalized identities and act like it's not part of our everyday lives. It is. All of us, if we're not living with disability, we have somebody close to us that we know who by law would have a disability, right? So when we start to see disability and these other identities as part of being human, we can start thinking differently about what's the world we're trying to create, what's our role as individuals and communities in creating those spaces.
But I believe we do have time for questions from the audience, right? Do we have any questions coming in the chat?
I just wanted to make sure that we have time for any questions. Do we have some in the
Sure.
chat?
We have a couple.
Okay.
And the first one is maybe a little, I'll do the quicker one first. We have one question that asks on this note, can anyone recommend some good disability trainings for private organizations? Jan briefly answered and said regional ADA centers can train private entities. Wanted to hear from other members of the panel if you had other thoughts on that too.
It depends, I mean, it depends on what kind of training they're looking for. I think the ADA centers are a great place to start. They know, because we're regional, we know our local resources. So even if we can't provide the training for you or meet the needs of your specific ask, we can refer you to someone who can, or we can connect you with another organization that does specialize in that area. So we're available. We do technical assistance at no cost. So it doesn't hurt you to call and say, here's what I need, who can help me, right?
And I just wanted to throw out, in the same way that some of you may have participated in a race equity challenge to learn more about disparities there, and we got to see lots of like mini videos and things like that that just gave us some background on all of the biases. Jan and I have been asked by our organization, the Public Health Institute, to come up with some internal trainings and a list of some key resources for them. And so we're going to be doing that and then putting that out there, at least those list of resources and videos, just some things that folks can do as a way to challenge themselves to their own internal biases. And I think those can be shared with organizations like some simple things like watching the movie Crip Camp on Netflix is a great one to give you some disability rights history, but also just kind of see the day-to-day challenges. We were talking about the healthcare barriers. There's a scene in there where a woman goes in with severe abdominal pain and they end up, I think, taking out her appendix. Well, it turns out she had an STD, but because she had a significant disability, they never thought that she was sexually active. And so they never even bothered to test for some of those things. And so there's just some eye-opening moments in there that there are videos out there that you could watch to just kind of check your own personal biases. And that's really cool.
I think that's a great idea. And Crip Camp, it's CRIP Camp, is a fabulous film. And Faye Ginsburg is the one that recommended that I see it.
Oscar nominated, really good.
Crip Camp. True story.
We have one more question right now. This question asks, with artificial intelligence becoming so prevalent in medicine, what should medical practitioners keep at the top of their minds as it relates to people with disabilities and artificial intelligence, especially when AI tools are increasingly being used to triage patients?
So we do a lot of this work for EARN in terms of using AI in hiring and employment situations. And I think a lot of the problems are the same. The people who set up AI to make decisions are doing it for the general population. So the training that it gets is not accounting for people who may present differently, right? So they're not gonna, well, this person can't walk. Well, that's a problem. Oh my God, AI is gonna be like, that's terrible. That's the issue. When it might be the underlying condition that is totally irrelevant. So if you guys want to read more about it, at least for the employment section, we have a lot on askEarn.org to kind of highlight some of those issues. I think a lot of them would be transferable because a lot of it is in how it's set up, how it's checked by humans, how we follow up with machine decisions, because they are machine decisions. And so much of it is reliant on programming, but I'll shut up and let somebody more knowledgeable about it in the healthcare setting talk.
I don't think.
Yeah, no, I mean, I would just chime in here that, yes, if you've got, I mean, even before AI becoming a big part of this, disability is not well documented. There's not, in medical records, there's not good ways to filter out specific types of disabilities and see trends and understand how that intersects with whatever their current condition is presenting. And so I think that I think while AI is going to have a lot of positive impact on the disability community as far as accommodations and making things better, I think there's also this danger of over computerizing something that is highly complex and highly individual. No two people with the same disability are the same. And so that can be problematic. Lainey, I see your hand raised.
Thanks. So I know that there's lots of challenges in this arena. I just want to offer as an alternative, I know for government agencies, we and all agencies have to offer effective communication, but offering an alternative way for folks with disabilities, if they choose to do so, to access the same care, information, or resources that are provided via AI. So for instance, on all of the County Maroon web pages, there's a statement that says, if you're a person with a disability and require an accommodation to participate, and has my contact information. So that if folks encounter any barrier in the process of participating in a county program, service, or activity, or getting on the website, or filling out a form, they have a mechanism to connect with a person that's knowledgeable about disability and the organization, the services that are provided, and to help engage in an interactive process to do a program modification so that they're able to obtain those same services. So just making sure that if you're a municipality, that there's a contact for the ADA coordinator. If you're a private organization, that there's an opportunity for folks, if at any time they experience a barrier, to contact someone who's knowledgeable about assisting them in navigating through that process. Obviously, we want all processes to be able to be navigated independently, and for folks with disabilities to have independence and autonomy, just like everyone else when they're doing self-service options. But I think it's always good to understand that nothing online is ever going to be 100% accessible to everyone because of the nature of disability and the individualized nature of accommodations. So having options for folks with disabilities to contact someone who's knowledgeable to help navigate through those barriers and through those systemic problems, I think can be hugely beneficial. And then, as has been spoken over and over again, just training, for the folks that are doing the programming and creating, going through the AI, making sure that they have some baseline understanding of folks with disabilities, and that accommodations will need to be made, I think is really important.
And I would just add that all of these processes should include people with disabilities as part of the planning and design process. All kinds of disabilities, so that we're more likely to catch the issues that might arise.
Great, yeah, great input there.
Well, if there are no more questions or comments, thank you so much for sharing, all of you. Thank you for staying to the very end. We want to thank you so much for being with us today, and a special thank you to our panelists and our wonderful collaborators, and Owen for helping organize all of this and did a great job at it. Thank you all so much. It was great to see you, and we will keep you posted. We'll try and do this again sometime next year. Thank you.
Thank you.
Thank you, guys. I wish we could share our bagels and lox with you, but we can't. So